Hi, I'm Dr. Broussard with the Waggin Trained Veterinary Clinic, and in today's segment we're going to discuss spaying and neutering of cats. My assistant Cole and I have put together a list of questions that we're going to run through and that will hopefully give you a better understanding of that subject. So Cole?
Dr. Broussard, what is cat neutering?
Okay, interesting first question that I wasn't prepared for, because by definition, at least the way I was taught, neutering is to sexually alter your cat. So by definition, you could say neuter, and that could apply to a male or a female. That's my trivia for the day. Most people say spay and neuter for a male. Spay for a female, neuter for a male, because nobody wants to say castrate for a male. Anyway, that is what it is. If we're talking about neutering a cat, it is the physical removal of the testicles from a cat, from a male cat. That was your question, right?
Yes.
Okay.
What is spaying a cat?
Spaying a cat is a term that most veterinarians don't like. A better term is ovariohysterectomize. That's a lot, which is why we say spay. But spaying is when you physically remove, a la surgery, the ovaries and the uterus of an intact female cat so they can no longer reproduce.
How does spaying or neutering impact the health and well-being of your cat?
In many ways. I'm smiling because it sometimes makes them more handleable for their veterinarians, so that's a selfish reason. No. It will certainly decrease aggression, particularly in males. It will decrease that territorial nature, which often leads to aggression. It will decrease their tendency to roam because they are looking to propagate their species, and when they don't have the desire, they don't roam. And yeah, let me stop there on that question. Yeah.
How soon should you bring your cat to see a veterinarian to get them spayed or neutered?
Good question, and a lot of debate on that one. 6 to 7 months is usually my quick answer on that one. Why? I don't want to neuter a cat necessarily, or a spay for that matter, at 3-4 months old. Can it physically be done? Yes. It's more of an anesthetic risk if you do it then. I like to do it a little bit later. I do like to catch them before they come into their first heat cycle in females, and a male is not normally sexually mature until closer to 8 or maybe even 9 months. But again, my answer, 6 to 7 months. If you do it then, you're catching them before you get to those annoying stages where they can come into heat, change behavior, get pregnant, all those other things. But they're also old enough to where you're not dealing with a very small pediatric patient as well.
What are the medical benefits of spaying and neutering cats?
Well, I kind of briefly touched on some. I guess maybe more what I was talking about was behavioral. So the medical side, really the first thing that comes to mind would be cancer and cancer prevention. Females, you can't get uterine ovarian cancer if you don't have a uterus or ovaries. You can't get a uterine infection or pyometra if you don't have a uterus. Yeah, same thing on a male. Kind of hard to get testicular cancer if you don't have them anymore. So those are the obvious silly answers. One other thing that we will sometimes see on these guys, on the females, it's been proven in a bunch of different studies that the more heat cycles or estrous cycles that a female animal goes through, the more likely those guys are to develop mammary cancer later in life. Okay? It varies on what studies you look at, and I think most of the studies were done on dogs, so I won't go there. But there is enough evidence there to support that the earlier you spay them, the less likely they are to develop mammary cancer later in life, and that's another big one, of course.
How should I care for my cat before and after spaying or neutering surgery?
Before, if we're talking like long-term before, like the months before the surgery can be done, it's just taking caution to make sure that they do not roam, that they are enclosed and unable to roam, or because when I say roam, what happens? They cross the street. We all know it can happen there. So I mean, there's just so much room for accidents to happen if they're allowed to be outside and to do that. If they're indoor animals, then there's not much you have to do before. You just keep loving on your cat and providing food, water, and shelter, and they should be just fine. After the spay or neuter, your veterinarian will give you specifics, but on average, they're going to be laying low for the better part of a week afterwards. Certainly no bathing, minimal exercise. If you have to, you can kennel them or confine them to a certain area, but you just want to prevent trauma to that surgical site. In particular, female, but also male, there will be certain precautions that will have to be taken to avoid any damage to the surgery site. Okay? All right, guys, I hope that answers some of your questions. I was a little sillier than most today, but that's all right. If you have any questions or if you do want to schedule a neuter, give us a call. Come by the office or reach out to us on social media. Thanks for tuning in. We'll talk to you soon. Take care.